Have you experienced any of these symptoms recently? If you feel like this, it might be rheumatoid arthritis. In this video, we will tell you about what rheumatoid arthritis is, its symptoms, self-check, and treatment methods. Hello, we are Medivery University Hospital. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. What is rheumatoid arthritis? Rheumatoid arthritis is a disease in which the tissue called synovium inside the joints abnormally proliferates or becomes inflamed, causing chronic inflammation in the joints themselves. Inflammation occurs around the joints because an immune substance called cytokines is excessively produced. Originally, this immune substance has the function of exterminating external enemies, such as bacteria and viruses, but sometimes it mistakenly attacks one's own body. Such diseases are called collagen diseases or autoimmune diseases. In rheumatoid arthritis, this inflammation not only causes pain in various parts of the body, but also, as it progresses, the cartilage and bones of the joints are destroyed, impairing the function of the joints such as bending or extending the wrists and fingers. In addition to these joint symptoms, systemic symptoms such as anemia, fever, and malaise may also appear. Previously, it was considered a difficult-to-treat disease, often described as having to live with pain for life. But now new drugs have been developed, and more people are experiencing milder symptoms and prevention of joint deformities. Starting treatment early can be highly effective. Symptoms of rheumatoid arthritis. The key points of rheumatoid arthritis symptoms are morning stiffness and symmetrical symptoms on both sides. A common complaint from patients is that in the morning my hands are stiff and it takes time before they can move normally. Additionally, the joints in both hands and feet swell and hurt symmetrically. Many people first experience swelling and pain in small joints such as fingers and medium-sized joints like wrists, but in some cases, symptoms may also appear in larger joints like knees and hips. As the disease gradually progresses, symptoms such as accumulation of water in the knee, difficulty in moving joints, and pain that prevents walking begin to interfere with daily life. Furthermore, rheumatoid arthritis is not limited to joints but also involves systemic symptoms. Patients may experience dizziness due to anemia, general fatigue, or a slight fever. In severe cases where the disease progresses rapidly across the body's joints, the joints in fingers and wrists can be destroyed, leading to shortening of fingers or severe deformation due to dislocation or subluxation. Subluxation refers to a condition where the bones that form a joint are slightly misaligned from their normal position, creating a state of being partially dislocated. In some cases, dislocation is defined as a condition that cannot be corrected without assistance from another person, while subluxation can be corrected by oneself. Similar severe deformities can also occur in the toes. The most frightening aspect of joint deformation and destruction is the possibility of the top bone of the neck shifting forward, compressing the spinal cord, leading to paralysis of the limbs or respiratory failure. This condition is known as atlantoaxial subluxation. Causes of rheumatoid arthritis. The causes of rheumatoid arthritis are thought to include genetic factors and infections by bacteria or viruses, but the exact cause is still unknown. Rheumatoid arthritis can occur in any age group, but it is particularly common in women in their 30s to 40s. It is estimated that there are about 700,000 rheumatoid arthritis patients in Japan. At the time of diagnosis, some patients may have mild symptoms, while others may have severe symptoms, and the symptoms vary. If you have any concerns, it is advisable to seek medical attention early for prompt diagnosis and treatment. Pathology of rheumatoid arthritis. Rheumatoid arthritis is considered a type of autoimmune disease. Autoimmune diseases are a general term for diseases in which the immune system, which is originally designed to protect the body from external enemies such as bacteria and viruses, mistakenly attacks and damages one's own body. It is also known as collagen disease. To explain more specifically, one's own immune cells mistakenly produce antibodies that attack the synovial membrane of one's own joints, causing lymphatic cells to accumulate in the synovium and resulting in inflammation. The synovium then produces various inflammatory and destructive substances centered on cytokines, gradually destroying the surrounding cartilage and bones. As the joints are destroyed, the pain gradually intensifies, but in some cases, once the joints are completely destroyed, the inflammation subsides, leaving deformity, and the pain disappears. Could it be rheumatoid arthritis? As mentioned at the beginning, there are several signs of rheumatoid arthritis. Check if you have any of the following symptoms. Rheumatoid arthritis check. Stiffness in the hands that lasts for more than 30 minutes after waking up in the morning. Difficulty opening doorknobs or jar lids. Difficulty using a stapler or scissors. Difficulty dressing or undressing, such as with zippers or buttons. Difficulty handling chopsticks. Feeling discomfort in everyday movements. Symptoms of general malaise, such as anemia, dry eyes, fatigue, loss of appetite, and low-grade fever. It is said that symptoms are more likely to appear when waking up in the morning. If any of these apply to you, it is recommended to visit an orthopedic clinic. Diagnosis of rheumatoid arthritis. Rheumatoid arthritis is diagnosed based on the diagnostic criteria of the American College of Rheumatology. These criteria consist of a total of 7 items, including various symptoms, blood tests, and changes in X-rays. A diagnosis of rheumatoid arthritis is made if 4 or more of these items are applicable. The various symptoms must have persisted for more than 6 weeks. Among these criteria is an item for a blood test called rheumatoid factor. However, a positive rheumatoid factor alone does not diagnose rheumatoid arthritis. It merely satisfies one of the criteria, and a diagnosis of rheumatoid arthritis cannot be made based on this result alone. Moreover, since the rheumatoid factor can be elevated in diseases other than rheumatoid arthritis, recently, there has been an increase in cases where more accurate evaluations are made by measuring MMP3 and CCP antibodies in addition to the rheumatoid factor. How does rheumatoid arthritis progress? The progression of rheumatoid arthritis is classified into the following 4 stages. Stage 1, early stage. No changes are seen on X-rays, and there is almost no impact on daily life. Stage 2, moderate stage. Cartilage begins to decrease and the space between joints narrows. You may feel discomfort in your joints, but you can still manage your daily activities on your own. Stage 3, advanced stage. Bones and cartilage are being destroyed. You may need assistance for going out, but you can still manage your daily activities to some extent. Stage 4, end stage. Cartilage is gone, bones are fused, and joint function is lost. Daily activities become difficult, and you may require a wheelchair or bedridden care. It becomes difficult to treat rheumatoid arthritis once it reaches stages 3 or 4. It is desirable to detect and treat rheumatoid arthritis early in stages 1 or 2. If you are concerned about any symptoms, it is recommended to consult a specialist in orthopedics, rheumatology, or connective tissue diseases. If you are unsure where to go, it is advisable to consult your primary care physician for a referral. Treatment of rheumatoid arthritis. As mentioned repeatedly, early detection and treatment are important in rheumatoid arthritis. The treatment is mainly medication-based, primarily anti-rheumatic drugs and non-steroidal anti-inflammatory drugs, and for some patients, steroid drugs, immunosuppressants, and biological agents are also used. As an adjunct treatment to relieve pain, injections of steroids or hyaluronic acid into the joint are sometimes used, but this does not lead to a fundamental solution. Rehabilitation is also effective. Thus, treatment is centered on medication. but if the inflammation and destruction of the joint progress over a long time, surgery for artificial knee or hip joints or spinal surgery may become necessary. Additionally, if the lumbrical tendons of the fingers are torn, a surgery called tendon repair may be performed to suture the tendons together. Now, let's explain each treatment method. 1. Pharmacotherapy. Anti-rheumatic drugs suppress abnormal immune substances that cause rheumatoid arthritis and prevent the progression of joint destruction. It takes about 2 months to half a year for the effects to appear, but the medication is adjusted by changing or combining multiple drugs depending on the situation. Non-steroidal anti-inflammatory drugs suppress inflammation, which is the cause of pain, and relieve pain. Steroid drugs obtain both effects of suppressing immune substances and relieving inflammation and pain. Biological agents. Similar to anti-rheumatic drugs, they suppress abnormal immune substances that cause rheumatoid arthritis and prevent the progression of joint destruction. These are relatively new drugs developed recently. 2. Rehabilitation. The purpose of rehabilitation is not to treat the cause, but to recover or prevent the worsening of joint damage caused by rheumatoid arthritis. When joints are destroyed by rheumatoid arthritis, the movement of the joints worsens. Muscle strength decreases, making it difficult to exert force, and fine movements become impossible due to deformity. The goal is to improve these conditions. Specifically, the following exercises are performed. Finger exercises, repeat opening and closing the hand, or pinch small objects. Grip strength exercises, squeeze a sponge. Wrist exercises, extend the hand forward and move it up and down. Leg exercises, sit on a chair and bend and straighten the knee. 3. Surgery. In cases where medication and rehabilitation do not produce results, or in the final stages of symptoms, surgery may be performed. In particular, a procedure called joint replacement surgery is often performed on the knee and hip joints, but occasionally on fingers and elbows, and fixation surgery may be performed for subluxation of the neck. The length of hospital stay varies depending on the surgical site, but it is generally around 2 to 4 weeks in Japan. However, if additional rehabilitation is required, some patients may be hospitalized for about 3 months. In Japan, the cost is covered by the high-cost medical expense system. There may be some differences depending on the type of insurance and income, but the patient's out-of-pocket expense at the counter is approximately 70,000 yen to 100,000 yen. If you want to know the exact amount of your own burden, please check with your health insurance association in advance. Precautions when surgery is decided. If surgery is decided, be sure to quit smoking. Smoking can worsen the healing of wounds. Also, if you are undergoing treatment for osteoporosis, be sure to report it to your doctor. Osteoporosis can affect treatment. Lifestyle habits to be careful of with rheumatoid arthritis. There is no specific food that cures rheumatoid arthritis, but it is important to take care of the muscle weakness and weight gain that often accompany rheumatism through diet. For muscle strength increase, try to consciously consume these ingredients. For weight management, be careful not to consume too many calories by eating too much sweets, rice, or bread. Also, as a review of a joint-friendly living environment, it is desirable to switch from Japanese-style toilets to Western-style toilets, from tatami mats to chairs, and from futons to beds. Additionally, using a pillow that does not fit your neck can increase the burden on the cervical spine, which supports the head, so caution is needed. Wearing high-heeled shoes can also increase the burden on the ankle, knee, and hip joints, so this requires attention as well. By paying attention to these points, let's reduce the burden of daily life. And if you think you might have rheumatoid arthritis, it's a clever idea to visit an orthopedic clinic or other medical institution early. We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comments section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.